Great, thank you very much. I think we can get started. Good morning, good afternoon, good evening, wherever you are. My name, me speaking, I'm Dr. Jean-Christophe Rosatira. I'm with the Bill and Melinda Gates Institute at Johns Hopkins University. And we'll be co-hosting this webinar together with the World Bank. So this morning, or this afternoon, this evening, we have great speakers. And I will display the agenda here as I go through the speakers that are with us today. So as you saw on the poster, we'll be focusing on the economic response to save lives and livelihoods. And our speakers, we'll start with Samira, who is the Global Lead Population Development at the World Bank Group. And we'll continue with AJ Tendon, who is the lead economist, together with Patrick. And we'll go through an experience from Pakistan by Her Excellency Minister of Health, Population Welfare, Dr. Ezra. And we'll end with an experience from Ghana by Dr. Anthony, who is the Presidential Advisor of Health in the Office of the President of Ghana. Thank you very much for joining us. And our colleague Simin will be monitoring the chat room as we go through the presentations. So welcome, Samira. I will give you the mic so you can get us started. Thank you very much.
Hello, good morning, and thank you very much for the welcome. And I would like to particularly thank our guests who've been more than graceful in accepting our invitation. Can you see my screen?
Yes, we can see it. Maybe you can put in the slideshow.
Yeah.
Yeah.
I'm trying. Okay, is it good now?
Yeah, it looks perfect.
So what I'm going to present is
just give me a minute. Let me just it's falling down here.
Is that Martin? Can I go on?
Yes. So you may put a slideshow to go through. We can see your screen, but yeah, you can go ahead. It looks good.
Okay.
Yeah.
Okay, great. So what I'm going to present is really a very general take and framework on what does it mean to have this pandemic, which is really a public health issue to begin with, yet it actually impacted all walks of life, and specifically the livelihood, the economies. And this is based on a report that the World Bank put together sometime in April, early May, that has the same title as you see on the slide. So I am going to, as I said, be fairly quick in just trying to paint the big picture, and then my colleagues will dive into the regional, and then we will hear from our guest speakers on the country experiences. So in a nutshell, all the policy responses that we'll be recommending to our clients and our country counterparts are grounded into two principles. The first of all, they need to be carefully calibrated with a view to priorities in the face of trade-offs. There has been, and there will be a lot of trade-offs in terms of what to promote and what to cut. Saving lives and livelihood today must be balanced with preparing also for an effective, resilient, and equitable recovery tomorrow. So the pandemic is not just going to disappear suddenly. It's going to be with us for a very long time, at least not in the form of the infections that we see every day, and unfortunately the deaths, but also that impact on the economy and on education and social protection and other walks of life, as you can as you can see. Now, I wanted to share this graph because to me it's very telling. It actually tells the entire story, and that is it has two halves, the upper half and the lower half. If you follow, for example, the red line on both graphs, this represents new cases without containment policies, and this is what it does to the health. While on the bottom, this represents recession without containment policies. And the blue lines are new cases with containment policies and the opposite in the bottom half. And this shows very clearly that the medical containment measures may make the medical crisis less bad. They made them more favorable to recovery. However, they make the economic crisis worse. And of course, this is not categorical. It's really context specific and it's country specific and what have you. But in general, we've seen, excuse me, that the lockdowns, the severe lockdowns or the aggressive lockdowns have actually impacted the economy much worse than the other ones, despite the fact that it actually may have saved a lot of lives. So this is what we call trade-offs, and this is what we call that these policy responses needs to be calibrated against a lot of other factors, but the main one is actually saving lives. Now, the framework that I am going to address in a bit more details in the next two slides is really anchored on the human capital. So everything that we're doing is to preserve gains in human capital with communities and communications, services and food security, especially essential health services, promoting the work of the firms, private and public firms, and middle size and big size and small size, protecting finance, trade, and the markets, and also the macroeconomics and the public sector and governance. In the heart of all of this is this attempt to actually protect whichever gains a country or a subnational region has actually done in human capital. And then I wanted to end with you on some of the key principles that actually govern our response and our decision making. And again, trade-offs will be difficult. They are not straightforward and they are not run of the mill, and they should always be grounded against the country context. There is no one size that fits all, and there is no magic bullet into this. Really, it's a calibration, and it's a moving target. It needs to be revised and changed as we go along. And again, good data enable evidence-based adaptive policy decision-making. We need to be on top of our numbers at all times. And we've seen the myriad of numbers that's thrown at us every morning for the last 8 months or so. So we need to have data that's useful, that can be used, and that can be translated into something tangible. There has been a lot of talk about the whole of society before the pandemic, and I think it really took central stage in the pandemic because it is indeed a whole of society approach. When you look at the lockdowns and the pandemics and the distant learning and the supplement to incomes and the closure of some of the businesses, etc. So this needs a collective efforts. Of course, we are not going to ignore the fact that governance and transparency are important, and they are pillars of a policy response at all times, but specifically in this pandemic, because citizen trust and trust in government and trust in institutions is something that we cannot trade off for any reason in the world. And then we need to prioritize the vulnerable, and the vulnerability here takes another form and another issue altogether. I mean, besides the vulnerability that's based on income, on ethnicity, on religion, on remoteness, and all of these, we also have vulnerable in terms of population cohorts. We know that the pandemic have impacted older age groups because of the domiciles, because of where they are living. We also know that it has impacted people with the existing conditions and comorbidities. So our thinking of vulnerability needs to be expanded. Finally, and not of course the least, is that leadership is extremely essential. And I am not going to go into the politics of what's happening in some countries, one of which is where we're sitting right now, but we need to have factual, clear communication to align behavior and also build trust. It's very important that the messaging is consistent, it's clear, and people can actually build their lives around this messaging. So an ideal response would actually involve those four pillars: containing the pandemic, the economic response to save lives and livelihoods, supporting the post-COVID-19 transition and mitigating the impact of future pandemics, and then finally preparing for and stimulating an economic recovery. Containing the pandemic, I think we all know what we need to do, besides actually the quest for an effective vaccine and some therapeutics. Those attempts, those efforts to suppress the contagion usually generate first order gains. And we've seen it all over the world. We've seen it in high income countries, in middle and in low income countries, whereby the lockdowns have done some impact, and the release of the lockdowns have actually boosted the economy again, even in a recovery mode. We also need to pay very much attention to strengthening health systems to provide critical care now at this point in time. And we've seen also a pushback against essential health services, because a lot of these centers and a lot of these programs and a lot of these budget codes were repurposed to fight the pandemic, to the point that we actually have seen spikes in like other essential indicators like maternal and child health. Disease surveillance, of course, cannot be stressed enough, because we need to be prepared for another future breakout, God forbid, but it seems that we have been through the Ebola crisis a few years ago, but we really have learned very little from what's been happening. In terms of the economic response, we need to sustain food security and access to essential services again, and we need also to look over in the future to sustain the economy, protect firms, jobs, households, and individuals at the same time. And then the third pillar, and when it comes to supporting the post-COVID transition, as the countries start the process of returning to normal, governments and other institutions will need to prepare to protect people from both the possible resurgence and other future pandemics. We know that pandemics are opportunistic occurring. So, like for example, we're talking a lot here in the United States about the upcoming flu season because of the change of weather and the pandemic. So the double burden, and sometimes it's a triple burden. And finally, preparing for and stimulating an economic recovery, we need to make sure that there is enough sustainability and enough stability in the financial markets and in trade in general. We need to have some form of a stimulation of the recovery, and this may take a long time or a shorter time. Really depends on the country context and on the pre-COVID status of all of these pillars. And then no one can do this alone. We really need to work together, hence the notion of leveraging international cooperation. We've learned this lesson way into this work, but I think it's worth repeating as well. So I will stop here. Thank you very much, Chris, and I will hand it over to you again. Thank you.
Thank you very much, Samira. Thank you for this very informative presentation. Now we'll give the mic to AJ and Patrick to take us through the economic contagion for COVID-19, the implications for health financing.
Thanks very much, John and Samira. Basically, as pointed out, we'll just go a little bit more in detail, myself and Patrick, on looking at the economic contagion from COVID-19, and to highlight some implications for health financing in this context. This is building on work that is ongoing, that we are doing in both Asia and Africa, as well as globally. So it's reflecting some of that going forward. Just wanted to start by saying that COVID-19 is still very much with us, even though we've noticed in some countries the infection is plateauing or even declining. But if you look globally, I've just pulled out the latest data on the number of daily confirmed new cases, and have split them up.
Excuse me,
Yeah.
AJ. Are you displaying the screen, because we can't see your screen? Sorry for
you can't see the screen?
Yeah, yes. Maybe we need to have Samira stop sharing.
Yeah, it shows over here that it is sharing.
Okay. Let's see. Change the ring screen. I think we had to switch. Yeah. So can you check if you have two screens? You can share the other screen.
I think Samira, your screen is still. You
I've
need to
been
stop
trying
sharing.
to. I've been trying to. Just a second.
So there should be, if you go click on top, there should be something that says stop share.
Yeah, I don't find it. I find post sharing. Just a second. Sorry about that. I really apologize.
And that's totally fine. And
Or if somebody else can.
great.
Okay.
Now,
Now,
perfect. Maybe you can go back and restart. Thank you very much.
of course, thank you.
Okay. So you can see my screen, right?
Yeah, we can see your screen. It looks great.
Great. So basically, I just pulled out the latest data from in terms of the number of confirmed new cases, and have just tallied it according to income status globally. So this shows you the total number of cases among low-income countries versus lower middle, upper middle, and high-income countries, and you can sort of see. Initially, this was the number of cases coming from China, and then slowly it has spread across the board. Currently, across low-income countries, we still have about 2,000 new cases, and the y-axis here is in log scale, so the numbers go up exponentially, and so you can still see that across some of these income categorizations, the number of new infections is still rising, and we have almost 1 million confirmed deaths to date, with USA, India, and Brazil currently having the highest daily new cases. And then on the right-hand side, I've just taken out the same data, and I'm showing it only for developing countries meaning low income, lower middle, and upper middle income, split by region. And I just wanted to flag, again, there's a lot of dynamism and a lot of changes happening, but as of now, South Asia region, primarily because of India, has the highest number of daily new cases. And Sub-Saharan Africa, this is again confirmed cases, so it's subject to testing rates, is the lowest. East Asia and Pacific was the lowest for a long time. This is sort of the thick gray line over here. It is no longer the lowest. But again, in East Asia and South Asia, the growth of the new infections is highest. So the virus is very much with us. And also, as Samira pointed out, that it's not just its impact in terms of morbidity and mortality. There's also impact on non-COVID health related utilization. So we're seeing a decline in hospitalizations, in immunizations and antenatal care and other maternal and child health services. This is related to fear and lockdown. So the impact is not just around COVID-19 itself, but really also across other utilization of health services. I'm going to pass it over to Patrick.
Yes, thanks, Ajay. So still on the COVID-19, if we take a closer look at the distribution of the burden of the pandemic, we can see that cases and deaths are relatively fairly concentrated with 4 countries, so the US, India, Brazil, and Mexico, accounting for more than half of all cases, so that's the left panel, and also more than half of all deaths related to COVID, that's the right panel. These 4 countries represent about a quarter of the world population. So we see that while the burden seems fairly concentrated, the economic impact of this pandemic are, however, quite widespread. Ajay?
So as Samira was pointing out, this is not just a health shock, and it's also becoming increasingly clear this is an economic shock. And so for the rest of the presentation, Patrick and I will focus really on what is expected to happen, or what is it that we are seeing happening in the economic sphere. There's a lot of uncertainty still. we're not completely sure as to what's happened. So these are just projections for now, and these are the latest projections that we have. The left-hand side of this graphic again shows what's happening to per capita GDP growth from 1996 to 2024, forecast to 2024, again across low income, lower middle, upper middle, and high income countries. And I think the one key takeaway message is that if you look at the impact of COVID, it's expected to be far deeper than sort of recent regional and global crises. The most recent one was 2007 to 2009, and also relative to the Asian financial crisis of 97, 98. So the expected economic impact, the adverse economic impact on per capita growth rates of COVID-19 is expected to be much more adverse than recent crises and much more widespread. So as you can see, all levels of countries are expected to be affected: low income, lower middle, upper middle, and high income. Unlike the previous financial crisis, where the impact, the contraction was mostly in high income and upper middle income countries, there was some slowdown in growth, but not a contraction for lower middle income countries. And actually low income countries were not affected, at least on average, from the 2007-2009 global financial crisis. Similarly, I pulled out for taking out high income countries, just looking at developing countries by region. Again, we see a deeper contraction than previous crises and quite widespread, affecting all regions and all types of countries. Currently, it's projected to impact Latin American countries the most, but this is quite a dynamic situation, and these forecasts are being updated almost every month or 2 months. And even though at present projections indicate that perhaps by 2021 we will see an sort of growth bounce back, but that's subject to quite a bit of uncertainty. And just wanted to show another way of seeing what the economic crisis is the impact of it is going to be. So this is basically the average per capita income. If you look at all developing countries taken together, low and middle income countries, in 1996, it was about $2,419, and low and middle income countries increased in size by more than 1.5 times since 1996, despite some slowdown here and some slowdown here. And as a result of the current crisis, we are expecting quite a decline. And in terms of the years of economic output lost, it's about 5 years of economic gains that'll be lost. And it might take as many as 5 years, additional 5 years, to come back to the levels that existed pre-crisis. So, sometimes just looking at the economic growth rates doesn't give that sense of how much of loss in economic activity such a crisis can cause. And it's really the services sector that was hit the most initially, but it's also extended to manufacturing, and consumption has declined in terms of impacting, but so has investment to a lesser extent. So I've so far landscaped on average what we're expecting to happen, on average across low income, lower middle, on average South Asia versus Sub-Saharan Africa. But really, the extent of economic impact that is we are currently expecting is quite different across countries. So just wanted to get into the country specificity a little bit more. And in fact, Samira gave a very nice interpretation of really what is going to cause the economic contraction, and that's the lockdown, the degree of lockdown stringency, or the containment strategies by design are designed to reduce going out and having interactions and so on and so forth. And so as this sort of graph below shows you the degree of stringency of the lockdown that was implemented across countries. The point being was, across the board, countries implemented lockdown policies, and across the board, we are seeing a slow opening up. And this has had an impact on economic activity, a very important impact, a very primary impact. And the way this plays out is going to affect the future conditions in terms of what will happen to the economy. But it's not just the containment strategy that matters. So I'll add a couple more points, and I'll use the same language that Samira was using, in that there are also vulnerabilities and there are pre-existing conditions. So you can think of the degree to which countries were externally integrated as making them much more vulnerable to the economic contagion from COVID-19. So for instance, countries that are dependent on tourism, like Jamaica and Cambodia and Georgia and Thailand, are much more vulnerable to sort of the economic contagion effects because of their dependence on tourism. Similarly, countries dependent on exports, and in particular commodity exports like Djibouti and Cambodia and Congo, are vulnerable because of a decline in trade that is occurring. We have countries that are quite dependent on external debt, both for the public sector as well as for the private sector. And that sort of increases their vulnerability to this kind of a global economic shock as investors pull out, or it makes it difficult for them to get more resources. And also balance of payment deficits across countries. In Kyrgyz Republic, Mozambique, Paraguay are example of countries that are vulnerable even before going into COVID because of the high levels of external debt. And also remittances. So there are many countries that are quite dependent on remittances of workers that are working abroad. Nepal is very high, El Salvador, Honduras, Armenia. So we are seeing these countries, in addition to what's happening to the lockdown, these countries are facing sort of additional challenges as a result of COVID-19, additional economic challenges. And finally, also going into the crisis, I'll again, if Samira allows me to use her terminology, there were some countries that have pre-existing conditions of being fiscally vulnerable. So in terms of public financing, in terms of how their government financed their sectors, those pre-existing conditions are making it much more difficult for these countries to respond to the crisis. And several ranges of this are, countries like Afghanistan, Niger, Rwanda are quite dependent on external grants to finance their government spending. This is across the board, not just for health. And because the crisis is also affecting high-income countries, so how that might affect external grant financing is a key challenge that these countries are facing. Several countries have very low tax revenues even before COVID struck, making it difficult for them to implement counter-cyclical policies that can expand government spending to try and offset the declining economic activity. And examples are Nigeria, Myanmar, Bangladesh, Indonesia, very low levels of tax revenue collection in these countries as a share of GDP. And similarly, some countries had very high deficit levels, very high public debt levels, very high public debt servicing. So the amount of interest payments that you had to make going into the crisis. So a country like Sri Lanka, for instance, already had about 1/3 of its entire government budget going to service debt that it had already taken. So these are sort of pre-existing vulnerabilities from a fiscal angle that have made it more difficult for these countries to respond to the economic crisis. Back to Patrick.
Thanks, Ajay. So following up and zooming in on some of these pre-existing vulnerabilities, we can look at some key fiscal space parameter trends actually ahead of the current crisis. And here we are looking at the gross debt against government revenues, both in a percentage of GDP, between 2009 and 2019. And we can see that overall average debt increased across all income group categories and almost across all world regions, while the government's capacity to generate revenues remained fairly stable over the same period. So this implies that the government's capacity to mobilize resources to respond to the crisis and to sustain adequate levels of social spending going forward will be severely constrained. And this constraint will be particularly binding for low-income countries, South Asia, Sub-Saharan Africa, and Latin America, with relatively high gross debt levels and relatively low levels of government revenues on average in percentage of GDP, especially given the projected changes in GDP in 2020 and and 2021 coming ahead. Over to you, Ajay.
So as a result of all these different factors, the stringency of the lockdown, the degree of vulnerability because of integration with dependence on trade and remittances, and also due to pre-existing vulnerabilities related to low revenues, high debt, even going into the crisis, all those factors coming together are causing differences in how the economies are affected. And so far, we've only given you numbers, projected numbers that are averages. Here's just to give you a flavor of what we are currently expecting to happen across countries. Let me just explain this left-hand side graphic a little bit more. This is again showing you per capita GDP growth. On the x-axis, it's showing you the average per capita GDP growth in the past 10 years. So for instance, a country like India grew at almost 6% per year per capita. So it was one of the fastest growing economies before the crisis struck. And on the y-axis, it shows you the projected economic growth rate for 2020. And in India's case, the projection is it will go from almost 6% on average economic growth to minus 6% contraction of the economy. So and the difference between what your trend growth rate was and what are expected to happen is important, because if you're going very fast and then you have a significant decline, that can impact the economic output differently than if you were growing slowly. And here I'm just showing you all countries globally that have a population of estimated population of greater than 100 million. And you can see almost all the dots in this graphic are below the 45-degree line, and in fact almost all are below zero. So this is the unprecedented nature of the crisis, that I think almost 90 to 95% of countries will see their economies contract. So actually China, where the coronavirus actually began, is one of the few countries where the economy is not expected to contract, although there will be a significant slowdown. China is still expected to grow by about 1% per year in 2020, but most of the other countries will see a significant decline. Brazil, Mexico will decline by more than 9%. USA, Nigeria, Russia, India, minus 6 to 9%, so on and so forth. And again, this is what was projected. I think this is end July projections. We're expecting an update next month, and so these might as well change. The magnitudes might change a little bit, but the direction in terms of contractions occurring and so on and so forth, we are beginning to already see a lot of leading indicators that are suggesting that this is occurring. Patrick?
Thanks. So as a result of the projected decline in GDP per capita across the board, the latest bank projections report that when compared with pre-crisis forecast, COVID-19 is expected to push between 70 and 100 million people into extreme poverty, so below $1.90 per capita day in 2020. So to put that in perspective, historically, extreme poverty was declining at the global level at a pace of about between minus 1%, between minus 0.5% per year more recently. But as a result of COVID-19, the global extreme poverty rate is projected to increase from around 8.2% in 2019 to somewhere around 9% in 2020. So that represents the first increase in global extreme poverty since 1998, actually. And that effectively erased the progress made on that front since 2017. There's a small decline in poverty expected in 2021, but basically overall the projected impacts on poverty are likely to be long-lasting. Also, the number of people living under the international poverty lines for lower and upper middle income countries. So these are $3.20 and $5.50 per capita a day respectively, is also projected to increase significantly, signaling again that this social and economic impact will be widely felt. Overall, almost half of the projected new poor will be in South Asia and more than a third in sub-Saharan Africa. Ajay, over to you for the health sector implications.
So this is just to give you a flavor of the expected economic impact, the economic impact in terms of contraction of the economy, in terms of poverty rate increasing, of course, as unemployment is going up, household incomes have declined, and so on and so forth. And you know, and one of the things that we are finding is that the extent of the economic shock is quite uncorrelated with the extent of COVID infections in a country. So we have several countries where the number of COVID infections is actually zero or very low, yet they're going to be very badly affected in economic terms. So you know, this connection is so even if you have controlled COVID in your country, the economic contagion from COVID is still quite evident. And Sri Lanka is one good example of a situation like that, where the economic contagion is quite dramatic, even though they've managed to control the COVID-19 infections. So the next part is just to give a sense as to what could this mean for health financing and for health systems. And you know, there are a lot of factors that can impact, and this is just a simple schematic to try and get a sense as to what extent prevention and treatment measures, including social distancing and lockdown, which are leading to the economic crisis, might affect the health system in terms of service delivery, how it's governed, and the focus of our focus is really on the health financing and how these interact. So we are seeing the supply of health services being affected, the expanded COVID care, some crowding out of non-COVID supply. We are also seeing demand for health services changing. There's been increase in utilization for COVID, but a decline in utilization for other routine services. We're also seeing quite significant implications on other health determinants, and I'm currently sitting in a city which used to be one of the most polluted in the world because of air pollution, and because of the lockdown and COVID, the air pollution levels have improved significantly, and road traffic accidents have gone down. So you know, a lot of things are happening as a result of this, and the net effect, of course, we don't know as yet, but a lot of these things, how they interact will matter. But really, in terms of the health financing implications, it also depends on how the health system was financed, how much was coming from household incomes, and to what extent household incomes are declining, how much was coming from domestic government revenues, to what extent those are impacted. I made the point about external financing. In some countries that are dependent on social health insurance contributions are seeing much more of an issue related to unemployment. And of course, private insurance contributions. In some ways, the private insurance companies have benefited because utilization rates have tended to go down. But you know, countries where unemployment was linked to coverage, the beneficiaries are struggling. So a lot of factors can go into determining what might this mean for health financing. And so it really depends on how health is financed across countries. And if you just look at this graphic, it just shows you the levels of health spending in per capita and a share of GDP. This is total health spending. For instance, if you look at low-income countries, spending about a little bit less than $50 per capita on average, about 6% of GDP, and the levels increase as countries become richer. But how that health is financed, how that health financing is sourced, varies quite significantly as well. And for instance, for low-income countries, about a third of their $50 average is coming from government revenues, both domestically sourced government revenues as well as external financing that passes through the government. The yellow part is external financing that is not going through the government budget, and about 40% of health financing before the crisis was due to out-of-pocket financing sources. So in terms of trying to understand what this impact, this economic impact might have on health financing, we need to try to understand what the contraction may mean for government financing, for external financing, and for out-of-pocket financing, and so on and so forth. So we have a working paper. if people are interested in seeing more details, but kind of that's how we've tried to take a look. And we've also tried to take a look at what happened during previous contractions when countries had a negative GDP growth, what happened to out-of-pocket spending, what happened to domestic government revenues, what happened to external financing during the previous crisis, to try and get a sense as to what could happen and what could be done to prevent adverse effects. And I think one of if we look more specifically at government financing or public financing on health, I think one key takeaway point is that that's not just a function of what's going to happen to GDP per capita. GDP per capita from a spending point of view, there are 4 or 5 big chunks. GDP per capita is dependent on how much households consume, so that's called consumption, versus how much firms consume, that's called investment, versus how much is the size of the government in the economy, which is basically the public expenditure share of GDP, and exports, net exports. So really, if you want to take a look at public spending on health per capita, you have to take a look at GDP per capita, what's the size of government in the economy, and what is health's share of government spending. So before COVID struck, just an example from India. India is a lower middle income country, about $2,100 per capita. The size of the government is about 28%. That's quite typical for a lower middle income country. It's a function of how much revenues you can raise, but also how much borrowing you've done. And only about 4%, among one of the lowest shares in the world, went to health of that. And those things put together gives you about $21 per capita, or about 1% of GDP is public expenditure on health. Quite low, nowhere near some of the benchmarks that are noted. I think a recent study said the benchmark is about $90 per capita in terms of how much public spending should be. But the point here being that we are currently projecting a contraction in GDP per capita in India, but really the impact on public spending on health is not just a function of what's happening to GDP per capita. It's a function of what happens to government spending as a share of GDP, and also to health's priorities. So it could be that in India's case, if the government increases government spending as a share of GDP by, for instance, borrowing more or raising more revenues, and increases health's share, you may not see a decline in public spending on health per capita. Although, that's just in terms of trying to think through what might happen, but it's sort of taking these 3 things into account. So we are taking a look at across countries, but here I'm just showing you what is currently projected to happen across low-income countries. And this first graphic is just showing you public revenues as a share of GDP and tax revenues as a share of GDP. And if you pay attention to 2020, you can see across low-income countries, we're expecting public revenue share, tax revenue as a share of GDP to decline, and also total public revenues. The rest is non-tax revenues and grants to also decline as a share of GDP across low-income countries. So not only is GDP declining in these countries, but also the revenue share of GDP is projected currently to decline across GDPs. And so it's sort of a double whammy. And we are projecting shortfalls in revenues to be made up to some extent by increased borrowing. So even though there was a decline in revenues, in tax revenues, we are expecting the level of deficit financing to rise quite a bit. So actually public spending share of GDP, we're expecting on average to increase, again, to try and offset the decline by stimulating, this is spending on COVID, but also on social protection programs, on trying to stimulate the economy, on giving tax breaks, and so on and so forth. This is quite typical as to what's happening across all sorts of countries. On average, in lower middle income, upper middle income, high income countries, we're seeing the same trend that revenues are declining, tax revenues are declining, but borrowing is going up to some extent, trying to mitigate the economic impact. And as a result of that, debt levels are projected to rise quite high. And for low income countries, they're projected to go, they were already above 60%, but to go much more above 60%, kind of like a danger zone that's pointed out by the IMF, and also I've marked here 15% of GDP because the IMF has recently recommended that tax revenues should be at least 15% of GDP as a benchmark, because that makes it easier for countries to be able to have sustainable growth. And you can see that across, at least on average, low-income countries are nowhere near that, already creating vulnerabilities going in, and now with debt going up. What that means is that the implications of the crisis will not be limited to 1 year, but will likely be felt many years down the line, because this debt, unless it is cancelled or has to be paid back. So the fiscal implications of financing any sector, including health, will potentially be affected because of this higher debt level. And just to finish up a little bit, we're doing some projections to try and look at if then else scenarios. And this is again showing you what we're expecting to happen on average across low income countries. The green line is just showing you the trend of what's expected to happen to public financing for health. I think that the key takeaway message is that across most countries, as a result of the global contraction, if they don't make any proactive efforts to change the priority of health in government budgets, we are expecting per capita total government spending to slow down or even become negative in some cases. And this risks reversing losing gains that were made in universal health coverage over the last several years. And in order to mitigate this, at least our current projections show that health share of public spending will need to increase to actually preserve these trend growth rates, and to also offset potential declines in OP spending, out-of-pocket spending, that we are projecting because of declining household incomes and declining utilization. And as a result of higher debt, as I mentioned earlier, greater debt servicing, fiscal tightening is likely to continue for several years beyond the end of the crisis. This is just to give you a flavor of what may happen or could happen. Of course, this may be mitigated if, for instance, health gets prioritized in government budgets, or there is debt cancellation, or there are other ways in which something can be mitigated. So the point here is to be vigilant, to try and make sure that, because some of these countries already have very low levels of public financing for health, so even some small cuts can really affect the operational costs of in these countries. So to be cognizant of the potential for this to impact health financing. Patrick?
Thanks. Yeah, thinking a bit about financial protection to finish. I mean, in addition to the projected decline in public financing, in public health financing that Ajay underlined, we can also expect an increase in foregone care and also in financial hardship, especially for the poorest. Looking back at pre-COVID household surveys, we know that about 15% of the global poor are really people pushed into poverty. They are new poor because of out-of-pocket payment. And maybe more importantly, a large share of the population facing financial hardship due to OP are the population which are already poor and who are pushed further below the poverty line because they have to incur out-of-pocket payment for health. So these are the orange bars for the different income group category for low, middle, and upper middle income countries. And they really represent the majority of the population facing financial hardship. In blue here, we depict the population facing catastrophic payments, so for which out-of-pocket payments represent more than 10% of their budget. In yellow, these are the new poor, so those pushed below the poverty line because of OP. In red, we have the population facing both catastrophic payment at 10% and impoverished because of OP. And really the large share of the poor push further below because of OP. This is the orange bar. So overall, that number of households facing financial hardship is likely to increase on the backdrop of the projected increase in extreme poverty in the coming year. Ajay, leave it over to you for the concluding points.
So just to end that, just give you a flavor of trying to landscape as to what's happening in terms of the economy. We now know a massive global economic contraction is occurring. As a result of the contraction, unemployment rates are rising, poverty is going up, as Patrick pointed out, inequality is going up as well. We're seeing a decline in public revenues, in remittances, in household incomes. And we're seeing most countries trying to increase borrowing to try and mitigate the effect of the crisis by also borrowing for financing the COVID response, but also to try and stimulate the economy and to implement social protection policies. So higher borrowing may help. I think as Samira also pointed out, what's happening at the country level is really what's important. This is just to give you a helicopter view. So the higher borrowing may actually mitigate the immediate impact, but of course the rising debt levels will imply fiscal pressures for many years. So, what can countries do? So, cutting unproductive spending, for instance, implementing health taxes on tobacco, alcohol, sugar, or carbon, debt relief measures will all be needed to look at as possible options for fiscal space for any sector, but including for health. And I think the point that we are trying to make is that some countries are far more at risk than others in terms of the projected economic impact and the impact on health financing. And on average, at least, we are projecting that without proactive reprioritization, that means without proactive efforts to try and protect the share of health in government budgets, we will see a stagnation or even a decline in some countries in public spending for health from already very low levels often. And this risks reversal of years of progress made towards UHC. And so health, as a result, will really need to make a stronger and clearer case for continued investments. And there's a perception out there that the health sector is flooded with new funds because of COVID response, but it's actually not completely clear whether or not that new money that has come in is actually additional, and whether or not it's being taken away from other health programs. So I think the importance of being cognizant of the risk in this case, and to make sure that at least to the extent possible, the envelope for public financing is protected. So I'll end here and hand it over to Patrick if you want to add any final points.
No, thanks, Ajay. Nothing to add on my end. Thank you.
Okay, thanks. Over to you. So Samira and Jean, it's back to you.
Thank you very much. Thank you for Ajay and Patrick for a very insightful presentation. So we'll go ahead and give the mic to Dr. Ezra, the Minister of Health and Population Welfare for the government of Sindh in Pakistan.
Thank you, Patrick. Courage, unmute. Thank you, Patrick. It's a pleasure being here today. Just coming to what is happening in Pakistan, and then focusing on what we are doing in Sindh on COVID. We have had in the whole of Pakistan almost 2.9 to 3 million cases of COVID, of which 132,250 were present in Sindh province. And we have had, this last week, we've had a percentage positivity of anywhere between 1.5 and 2%. The total, we have done total tests in the whole of the province of 1.1 million, and of these 132,591 were positive, and recoveries 127,724, which is about 96%. Deaths have been our deaths are 1.8%. Then we have the gender trends. As you can see in gender trends, we have had a male 69.9% male being affected, and 15.1.6% female being affected by COVID. I just wanted to give you this backdrop of what is demographically happening with COVID. We have the highest positivity has come between the ages of 20 and 30 to about 50 years of age. And this is because of the demographic youth bulge that we have. And we are the age difference, higher age, the older age population is less in numbers. So we see more cases in the younger population. We had our first case appearing on the 26th of February. And the next day, being 27th February was almost, our schools were the first things to be closed down. And following the weekend that after, we were supposed to open on Monday, but all schools in educational institutions were closed down as soon as our first case appeared. So in effect, we did a lockdown which was early, when we didn't have so many cases. We didn't have almost 0 deaths, and we still announced closure of schools. Following that, we closed down all our public spaces, including parks, cinemas, and our obviously stadiums of sports stadiums, our beaches, and then our industries, and and our shopping centers, malls, etc. So this whole procedure took us right up to, and public transport obviously, till the 21st of March. We had almost closed down the whole of the province. And following which, I think our COVID cases, the graph, if I show you the graph on this thing, I'll go back to the next slide instead of concentrating on this. If you look at the graph that comes almost on this slide, it'll show you that our cases jumped up after we opened up. We opened up somewhere at the end of May, and beginning of June, we started opening up all our sectors. And as you can see, the rise in numbers of cases that followed. But we have now plateaued because almost all though all our various sectors have opened up, including industries, transport, etc., but we have flattened up now, and therefore our cases are almost flat. Since the 15th of this month, September, we have started opening our educational institutions. So they had been closed almost now since March, right up to September 15. Now we started closing, slowly opening up our educational institutions. And this will result in maybe a second peak that we may see within a couple of weeks. I don't expect that we will escape the second surge that the other countries have also faced. And this may come because of our institutional openings. And this will also be followed by the flu epidemic that occurs during winter months. So second surge is imminent, but hopefully we are hoping that it doesn't occur. But well, seeing the picture that is before us of all the other provinces, of the other countries, we expect a surge to occur. During this COVID, now coming to the health part of it, during COVID, we saw obviously all hospitals did a triage system in the outpatient departments where they were screening people for COVID, not testing, but screening people for COVID to exclude them from and separating them from the general population of sick patients. And this helped a bit. Then all our elective surgeries were also closed down in our hospitals. So this was obviously impacting health services. A lot of people during the lockdown would not avail of our health services because of a fear of COVID and because of lack of transport within the cities. And this resulted, I think, in a number of people just suffering at home and not able to access the health services. Family planning, routine immunization fell by almost 50%. And this fall in our services also impacted was also impacted by the fact that many of our health personnel also succumbed to the disease and were infected, and therefore they had to close down the facilities. But however, Sindh was very proactive, and we came forward in March, and this was on the 21st of March, with our first edition of our guidelines on early stages of COVID for family planning and reproductive health. And this was followed by a second edition on the 9th, and then a third edition on September 14th. And we have also opened up by May, we had also opened up all our family planning services centers, and obviously we are now even doing surgeries for tubal ligations, which the doctors were reluctant to do as it is an elective procedure, and they were not doing it until now. Now since 14th, we have started those as well. So these are some of the things that were impacting our health services. We saw almost, the other thing that we noted was that the good thing, I think the positive factor about COVID was that during the last quarter of 2019-20, the budget that was allocated for other sectors was diverted to the health sector. So really, the government came forward with a lot of support for COVID, and this helped us a great deal in addressing and being able to handle the emergent situation of COVID, where ventilators were required, where high dependency units were required by the people at large. All our public sector hospitals had some beds allotted, and even some hospitals were totally allocated for COVID response. And there was a 3.9 billion budget from the exchequer of the Sindh government, and added to this was another 3.6 billion rupees, which were collected as donations or as salary cuts from our government sector employees and the legislators. So this was an added bonus to us. We still have the facilities, though some of our facilities are now closing down because the health department, we are seeing less occupancy of beds, less occupancy of ventilators. And almost it's come to a point where we really don't need our facilities anymore for COVID. Only a few facilities are required, but we're still waiting on it because we don't know if the next wave comes along and we may need these beds for COVID. Our elective surgeries have opened up, and we have now started doing almost all elective surgeries are being done by our medical doctors. And we can also see that during this, the financial impact of this was huge on the poor people, especially the daily wage earners during the crisis. When the lockdown was in place, people who are daily wage earners could not get jobs, and so obviously they didn't have incomes. However, they were free packages, food packages were given, and we also supported all our other middle income, lower income people by having a reduction in school fees by 30% in private sector schools. Government sector schools are all free of charge. Tests were conducted, all tests were conducted free of charge in public sector, and even the ones that were conducted in the private sector, because we needed support from the private sector to ramp up our numbers of testing. All the cost of the tests were picked up by the government. So in effect, all tests were done free of charge, irrespective of income in both public and private sector. This helped a lot in seeing that the people came forward for testing services. The other thing that I think is very important is the legislation that we undertook. And this legislation was to prevent layoffs during COVID crisis by both private and public sectors, and also legislation to decrease the fee in the private sector by 30%. Obviously now, coming to what is now currently the increase in health expenditure in Sindh government, by the Sindh government in this current financial year, starting July 2020 and to June 2021, we have increased it almost by 5%. The expenditure on health is being increased by 5%, and number of facilities is also being increased. The problem with government expenditures on health is that it is a bit lopsided, whereby we are spending less on preventive healthcare services and much more on the high-end, very highly visible specialist services, which obviously are very related to a large deal of mortality, but at the same time, a huge expenditure on the exchequer, and therefore eat up a large amount of budget of the health department. So this is one of the things that we need to now focus on preventive healthcare, and one of the most expedient areas of services that we want to improve is the infection prevention and control systems within our health services, our hospitals, our clinics, etc. And this is where we are working. And hopefully this will, the COVID crisis will be a strong warning bell for the government to understand that it is the preventive healthcare which is of utmost importance, rather than the tertiary services that eat up a major chunk of money of the health budget. Thank you.
Thank you very much for the great presentation and sharing the experience from Pakistan, Dr. Ezra. We'll give the mic now to Dr. Anthony to share with us the socioeconomic response to COVID-19 experience from Ghana. Dr. Anthony.
Yeah, thank you very much. I'm to share with you the socioeconomic response to COVID-19 in Ghana. The COVID-19 pandemic is far more than health crisis in Ghana. And And what you have seen is that Ghana has not been spared the economic and social impact that pandemic has visited on the people in all nations. COVID has impacted greatly on government's fiscal policy for the year. Example, there's a fall in revenue by about 26%. Initially, we targeted 29.759 thousand million Ghana cedis, but as at June, we had 22 million thousand Ghana cedis. What it means is that there's a fast expenditure increment up to about 46,000 million Ghana cedis, that's 12% of GDP, as compared to the targeted 41.5 million. So there's a deficit of increment of about 10% of GDP. This therefore has a very widened the fiscal deficit from our target of 3.1% of GDP to 6.3% of GDP. And the economic effects was due mainly first to restricted movements, the measures that we have put in place, especially disrupting households and businesses of consequent job losses and reduced incomes. The severely affected sectors are the hotel and hospitality industry, trade and manufacturing, agri, health is not left out, creative arts, media, transport, manufacturing, education, especially the private education units, and financial services have all been severely affected. We don't have any records of job losses in the public sector. People are working, but they are working half shifts. But many private sector employees have lost their jobs. We've estimated about 11,657 job losses in the private sector. And there's 50% reduction in earnings, especially entertainment and event industries, which have been affected about nearly 2,000 businesses in the country, with about 16,685 persons who have suffered pay cuts. and there are about 2,849 jobs, representing 24% job losses, which have been restored after the easing of the COVID-19 restrictions happened since July 1st. So what Ghana government has done as a preparedness plan for this social and economic interventions, there's a 100 million preparedness plan which was put in place. Immediate concerns were protecting lives and preserving the livelihoods of all our people, and then wanted to lay the foundation to save lives and safeguard economic activities, and to improve citizens' access to essential public services and help businesses to weather away the downturn. So that's what happened initially with 100 million preparedness plan. And Ghana has put what we call the Ghana Cares program, or what we call in our local parlance the Obatam program, which is about 100 billion development program. It's an ambitious 3.5-year program to anchor the comprehensive transformation that our government has initiated. Government has given also 650 million stimulus package to small and medium scale enterprises. Government, in addition to cut down the suffering of the people, gave 50% subsidy of electricity for all citizens at a cost of 1.02 billion cedis for the first 3 months. This electricity has also been given to free electricity to lifeline consumers, that is the poor and the vulnerable, and it's from April to the end of the year. Government also gave free water, which as at from April to June was 200 million Ghana cedis. But this package has also been extended, like the electricity, it has been extended to September this year. In addition, the government also gave free incentive for all health workers from March to September, so that hard-working health workers can put in their best. And then there's a 50% basic salary allowance for all frontline workers from March to September. Initially, it was up to June, but the government also increased it to September this year. So all health workers receive tax-free incentive. There were no taxes on their personal emoluments, and those who are working directly at COVID centers were given 50% of their basic salary as an allowance. What government did was first, when we have a partial lockdown for about 3 weeks, which had a lot of impact on the economy and on the people, especially the vulnerable, which government started giving free food and then also instituted free water for all the citizens. And it was only for 3 weeks to learn the dynamics and they studied the infection when it came initially. The partial lockdown was in the 2 major metropolis in Ghana, Accra, Greater Accra and Greater Kumasi metropolis and the surrounding districts. And after the partial lockdown, there was also some restrictions. For example, there was no public gatherings. Churches were not working and schools were all closed from March. So we put Ghana government then embark on a strategic control, progressive, safe easing of restrictions on public gatherings. This was to get the people and the economy back to normal or to near normal. So they were in we have the phase 1, then we have the phase 2 and phase 3. At the moment, we are in phase 2 or stage 2 and stage 3, which is we have the educational institutions, all the final year students were asked to go and finish their exams, including that from the basic schools, senior high school, and also the universities and tertiary institutions. As we speak now, the basic schools are finishing their exams tomorrow. So when they finish the exams tomorrow, it means all the final year or examination class are finished. We are also planning now to let the senior high school 2 and junior high school 2 also go to school and finish the term that they couldn't finish, because they will be having exams next year so that they don't lose too much. Apart from that, all the schools from JHS1, SHS1, who don't have any final exams to do, and then also the basic school from kindergarten to primary, upper primary are all at home. And all schools, including the universities, will be open for the next academic year in January. That's what we've been doing. The religious services were also modified from the beginning. And as at now, we have allowed them to go to church, but with social distancing and wearing of masks. and then following the protocols. Restaurants have now started opening the restaurants, but to social distancing and also encouraging open space eating. The airports were closed, but since September 1st, we have opened both the international and the domestic airports. International airports have been open, but of some kind of precautions and protocols. We ask for PCR negative test before you come to Ghana, and when you come to Ghana, we also do an antigen test, compulsory antigen test for everybody. So far, we have tested over nearly 7,000 people, and strangely enough, people of negative PCR tests within 72 hours, about 15 of them have tested positive that we are managing in our isolation centers. We have also conferences and workshops have also been allowed to open, but of enhanced social distancing and also wearing of masks. Funerals, which are one of our cultural activities that we do here, which is also an economic activity, we also allow up to 100 people for private burials. And then political activities, we are in a political season. We've banned political rallies, but town hall meetings are allowed under enhanced social distancing and the protocols. I'll give you a very short list about the update of what we have seen so far. In Pakistan, was talking about that, it look as if the disease is easy. The same thing in Ghana. If you look at this is the 1 week from the 8th of September to the 14th of September. We have reduced the number of daily cases, which is the one below. From now, we have about 46 cases in the active cases that have been detected positive in the case. In fact, on the 11th of September, we had only 29 cases throughout the country. There are about 13 of our 16 regions which have not recorded any case for nearly about 4 weeks continuous. The areas where we have the high burden is in Accra, Greater Accra, and Ashanti region. Ashanti region is sometimes it's recording 0, or sometimes in the digits less than 10. We also have a very high recovery rate of about 98.2% recovery rate in Ghana. And as we speak now, the active cases at the beginning of the week, that's on the 8th of September, was about 806. As at 14th September, we have less than 500, 492. Our death rate has also been about 0.6% of the positive rate. We have total loss, unfortunately, 295 people. So the current update, if you look at the current update of what is happening in Ghana, you realize that we can also say that Ghana, we are flattened. If you look at it, you see the blue shows the number of cumulative cases. The green also shows the number of recoveries. We have one of the highest recoveries, if not in Africa, I'm sure in the whole world. And we also have a very low fatality rate. So that's how the picture of the country looks like. But what we have seen is that the current update that I've shown with the declining, the severity of the disease in Ghana has been possible through able leadership of our Excellency the President, who has been very decisive, swift, innovative, and compassionate in the management of the crisis, and the commitment of our hardworking and dedicated health professionals, and the cooperation of the good people of the country, who are, in some way have been adhering to the preventive protocols put in place nationwide. So this is what we've been doing so far to make sure that we have the disease also under control. The pandemic has also been brought up to us the four of the structural gaps in our health delivery system. The government therefore have initiated what we call the Agenda 111 initiative, which involves design, build, equip, and staff new hospitals in every district, including an infectious disease center, 3 infectious disease centers in the 3 ecological zones of the country. We are trying to develop what we call the Ghana CDC, and we've also have 6 new regions which have recently created validation of government commitment to protect the lives of the people of this country. The government also will continue, as have always been said, to protect the lives and support the livelihoods through compassionate, competent, and courageous leadership. And until the vaccine is found, we have no choice but to rearrange our lifestyle in order to protect the lives and promote livelihoods. So we believe that we should continuously be following our strict protocols of mandatory wearing of masks, hand hygiene and hand wash and hand hygiene, and the use of sanitizer on the economic and social life of the people. But we believe that slowly we will bounce back and then come back to near normal. Thank you.
Thank you very much. Thank you very much. We have some issues with the internet. So thank you very much, Dr. Anthony. Great presentation. We have 10 minutes left on our clock. We welcome the audience to raise their hands and ask questions. It may not be like a very long time, but for the questions, but we'll use it as we have it. So please, anyone on the call, feel free to jump in with a question or a comment. So we had we had a question earlier about elaborating on the question online. Yeah, I think this is a comment. We have a question from Ali Hamandi. Many countries have lowered their taxes to provide support to businesses and households. Will this make future tax reforms more challenging? What would implications be on health sector spending? Yeah, the question was not to the specific speaker, so we'll open it for response. AJ, do you want to address this, or Patrick?
Jean-Christophe, I'm sorry, I didn't catch that. What was the question again?
So many countries have lowered their taxes to provide support to businesses and households. Will this make future tax reforms more challenging? Yes. What would implications be on health sector spending?
Yes, I think that the point about the declining revenues, the tax revenues and aggregate revenues, in part, those are also by design, because governments have reduced taxes also on some firms, for instance, to try and incentivize them to not lay off workers and so on and so forth. So I think that's, you know, it's difficult to say what the longer term implications would be, but in order for domestic resources to come back to levels as sort of the containment policies are lifted and as economic activity improves, I think some of that will have to be relooked at. And we're also seeing some countries also remove sort of unhealthy taxes like fuel subsidies. I believe even Pakistan removed fuel subsidies and so did several other countries in South Asia. And some have also started looking at health taxes a bit more, because there is a feeling that this is a time where the traditional opposition to health taxes from industry may not be there. So tobacco and alcohol, but also sugar and carbon. And so I think this is, you know, if people always say it's a cliche that sometimes crises are also opportunities, but this may be one which is worth looking at, and also one where the health sector can engage in the tax space and maybe something to initiate discussion on, and was wanting to hear if that is happening in Pakistan and Ghana's case or not. Over.
Great, thank you very much. And I think we have another question on Ricky, who asked whether how the World Bank is working with countries to mitigate the economic crisis. I see AJ has responded in the chat room, and Thomas Palu asked the question for Ghana and Pakistan. How are the next year's health budgets shaping up? Do you expect to receive adequate funding for health? What would it be compared to 2019, the latest regular year?
Yeah, thank you very much. COVID pandemic, so far as some of us are concerned, especially as the presidential advisor on health, I see it as an opportunity. For the first time, I believe strongly and I'm happy that health has become #1 priority in Ghana. The 2021 budget, I'm very sure, because I gave an example of us having a lot of infrastructure development so far as health is concerned. I'm sure we'll get our fair share, and if not even the lion's share of any money that we have in the system. Because we've realized that what we are doing at the task force is a multi-sectorial task force, where all the various, most of the social ministries are, and is chaired by the president himself. It has come to fore that we have to now look at health of all the priority that we deserve. Especially, we've realized that about 80% of the deaths that we have who succumb to COVID-related deaths are from the non-communicable diseases. So His Excellency the President is asking us that we should do whatever possible to make sure that we don't get to that stage where people who are diabetics, hypertensive, will succumb to any pandemic in future. So we are moving forward in that direction. We are also having to strengthen our social health insurance, that's the National Health Insurance Scheme, to make sure that the poor and the vulnerable are also covered. At least everybody should have a basic health care, not far away from where the person is. So we are strengthening the health systems from the basic level, which we call the community health planning system, based planning system, which we call the CHIPS. In all aspects, holistic aspect of health, both health prevention, promotion, education, and curative, and also have an emphasis on mental health. So I believe strongly that going forward in the next year's budget, health will have a very substantial amount in the health, the country's budgetary allocations. And we believe that we are going to use this as a transformation in our healthcare system. That's exactly the advantage that we want to take from the pandemic, so that Ghana Beyond It, which is the mantra of the government, will also continue, and it will show it in aspect of health. And this has brought forth what has the pandemic has brought into everybody's mind, that health is wealth. That's what everybody is saying, that if you are not healthy, there's nothing you can do. And I think that COVID-19 have actually woken everybody up that we should be very mindful of our health systems and then strengthen it. Thank you.
Thank you very much, Dr. Anthony. Dr. Ezra, would you also like to comment on this, please? Okay.
I wanted to comment on two aspects. One is the factor that the tax rebates that have been given. Our tax incentives have been given to our construction industry, which is the largest employment generating industry in our country. So that has been a positive step. But however, the energy bill has gone down to the consumers and to our industries, which will also impact our exports, because we are textile exporters, and it also impact the general population, because our electricity bills and our gas bills have gone up because of the higher taxation that has been done on it. The comment on the health factor, I think that COVID has been an opportunity for the health sector, because the finances have now improved considerably in our health sector and in both our development part of the health sector as well as our soft avenues of expenditures, which include our preventive side of the health sector. So we are really now, because of COVID, the opportunity is now to enhance health sector services in the public sphere. So we are hoping that this will, if the tax fiscal space does not contract too much, the promised amounts will be given to the health sector in the year 2020-21, and we will be able to improve health services considerably. Thank you.
Thank you very much, Dr. Ezra. I see we are already 2 minutes past the time, but we have one last question in the chat room, or it was already answered, that what is the best action for every country to lessen the effect of economic crisis, specifically, especially for the poor country? I request Dr. Samira to address this and probably also give a closing note.
Okay, thank you very much. And let me thank you on the Gates Institute for this invitation. This has been quite interesting and educational for me, at least. I always tell my colleagues who are economists, you ground it for us physicians who are more on the health as a right and health as a common public good and what have you. Today we've heard about dollars and cents and economies and protecting the poor and protecting the vulnerable. I think there isn't, just to go back to the question without really taking much of the audience time, I think there isn't a silver bullet really. It's a trade-off, and it's a context specific, and you change as you go along. But there are some key principles that we've presented at the beginning of this webinar that has to do with protecting people and protecting economies and preserving gains in the human capital and what have you. And it really depends on what the situation. The odd thing about this pandemic is that it really struck in the rich countries before it descended into the poorer countries. And also it showed us some of the more exotic responses that we haven't seen before. So I think the next phase, or the vaccine phase, hopefully will even show us more. So with that, allow me to thank sincerely our guest speakers, Her Excellency Dr. Azra and His Excellency Dr. Anthony for taking the time, and also my colleagues for putting this together. I know that AJ and Patrick are on very odd time zones, so thank you very much for helping making this a success, and thank you to the Gates Institute for hosting this.
Thank you very much. Thank you everyone for joining us, and thank you for the speakers. Really appreciate it.
Thank you.
Thank you.
Thank you.
Thank you.
End of the long day.